forced to play a useful role in the management of the current pandemic outbreak. So here it is. So it's probably now widely accepted that communicable diseases are major threats to public health and economy. What is less unknown is the great need for the critical tools to answer questions about the spatial temporal patterns of disease spread, such as the relevance to the transportation system and implication to disruption of social economic activities, the impact on the vulnerability of different populations, the usefulness in developing and implementing public health policy decisions. And we believe the key to answer those questions is geosimulation tools that can model and can predict the dynamics of disease spread across large territory by considering the characteristics of the agent-host environment interaction. We also believe the successful development of a decision system and geosimulation tools requires integration of mathematical and environmental modeling of the behavioral rules of interacting individual hosts, and requires also high quality data obtained through larger scale surveillance and also faithful interpretation analysis of data. So the project was designed to develop robust disease spread protocols by combining mathematical, vector network, environmental, and multi-level agent models to simulate the disease outbreak and also to evaluate the effectiveness of different intervention strategies. Our goal, as I said, is to develop cutting-edge geosimulation tools. However, I have to emphasize that the spatial temporal spread of infectious disease is an old issue. Even more than 2,000 years ago, there was very detailed document about the spread of the plague of Athens. Very carefully documented how the disease spread from Ethiopia, about Egypt, and then descended into Egypt and Libya, and then spread into Athens and caused tremendous human mortality. So this is an old issue, but with very substantial relevance to the modern society because mobility that contributes to the spatial spread of infectious diseases is big, it's huge. This mobility can arise from natural animal migrations, transportation of goods and livestock. It can relate to social, economical, political, and recreational human activities. What it implies is every migrant brings its own history and sanitary into the network. So the disease transmission network is highly heterogeneous. What is also important, what is why modeling the geosimulation which is spread so challenging, is also related to different means of transportation. Individuals can travel by private vehicle, can use public transportation, buses, boats, trains, and nowadays travel by airplanes. So the connection between the mobility, and especially the air travel and the disease spread globally, is clearly indicated by the global spread of SARS. So those of you who have been in Ontario for a long time probably still remember the SARS outbreak. This outbreak was first recorded in November 2002 in a very small village Guangdong province of China. It was then spread to Hong Kong in the spring, in February of 2003, and then within a matter of a couple of weeks, it spread to over 27 countries, to Asia, to North and South America, to Europe, and it was introduced in Toronto. So by the time WHO, the World Health Organization, declared the addiction of this disease, SARS had already generated more than 8,000 infections and caused almost 800 deaths. The connection between the SARS and air travel was very obvious. Among 36 cities, in 40 SARS cases, 24 had direct flight from Hong Kong. That's the first time it was the place where the SARS was reported by media, and 12 were just one stop away from Hong Kong. So it was shortly after SARS outbreak, two of our colleagues, Cameron Kang from St. Mike Hospital, Julia Reno from Manitoba, we started to examine the global air traffic network. They spent a lot of money and time to gain the access and to examine data from the official airline guide from the International Air Transportation Association. Those are data that about more than 800 airlines distributed over 3,000 airports. Those information includes, for example, potential and exact waters of air transportation, the travel between those airports. And if we try to translate those information into a graph, then we get this, the world is nothing but a network where each node is represented by airport, and the edge is represented by the direct flight between those airports, and the weight of the edge is represented by something related to the air traffic volumes. Okay? And this information seems to be extremely important to understand the importation of the pandemic influenza from Mexico City. So here's a map. The information is drawn from the tourist network I just showed you. It's about the destination cities and the corresponding volumes of international passengers arising from Mexico in the months of March and April of 2008. This is not data of 2009. And from that, and from some relatively simple, larger scale, what we call meta-population model, we can build a connection between the air traffic and the pandemic influenza importation. So here are some of the statistic data. In March and April of 2008, that's the year before the pandemic, about 2.35 million passengers flew from Mexico to over 1,000 cities in 164 countries. 80% flew to USA and Canada. And of 20 countries with the highest volumes of passengers arriving from Mexico, 16 had confirmed importation from Mexico on May 25th of 2009. So again, building from the air traffic information and from the meta-population model we're building, we have built the nonlinear relationship between the air traffic flow and the importation. It's a critical passenger threshold. We found that the countries receiving more than 1,400 passengers from Mexico City were a significantly elevated risk for importation. And this prediction seems to be very reliable and accurate. So this is one of the two major fundings in the very beginning of the pandemic influenza in July. It's published in the journal, New England Journal of Medicine, and we're very proud part of this funding. As I said, this was top 4 priority when we designed this GEO project. The reason at that time, 2 years ago, when we started to really develop the GEO project, a disease which is of high priority was the H5N1 avian influenza. This is a disease among birds and spread around the world. And most people tend to believe it was the migratory birds that play a role in spreading this virus. We know now H1N1 pandemic strain went to competition. It seems that the pandemic influenza is under control, but the risk of H5N1 avian influenza remains. Now, if you want to understand, try to appreciate the complication and the challenge of modeling the global spread of the avian influenza, just simply replace this global air traffic by the network of migratory birds. Represent each node by the breeding zone, by the summer breeding zone, by the winter zone, by the major stopover along the migrations of the white birds. And hiding the complication of seasonality, hiding the chicken farms, hiding the backyard activities, and hiding the national transportation system, and so on and so forth.